Hello and welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a naturopathic physician as well as a yoga instructor. And today I was going to talk about Marma Therapy, the Ayurvedic energy points on the feet. So this is actually the final video for the Marma points. I've covered in previous videos all the other points. There are 117 points on the body. So these are the last 6. So it's kind of exciting because I wasn't planning on doing a whole series or course on Marma Therapy or the points, but here you go. It's all available to you. I also wanted, before I start the talk, just wanted to thank everybody. I appreciate all of your support, showing up in so many ways, from writing very nice comments to watching, taking time to watch the videos. Some people have sent in donations, some people have subscribed. So there are all sorts of ways that people are supporting the work that I do here. It's all appreciated, especially since for the first part of my career I was mostly lecturing in front of people, and so I'm used to a little bit more kind of feedback. In terms of, well, at least immediate feedback, but this is also pretty nice because you can watch this at home at 3 o'clock in the morning in your pajamas, so if that's what you choose to do. So there's more flexibility in terms of space and time, but I certainly still appreciate all the nice feedback. It really motivates me to keep going with all this, so thank you. A note of caution, as always, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It's always important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective. Please keep that in mind. Also, solo therapies, such as doing Marma Therapy by itself, may not be appropriate or effective in all cases, especially since we're talking about the feet today. You know, we really wear and tear our feet just through walking, through our days, and the shoes that we wear and that sort of thing. So all that should be taken into account, especially with the feet. Just a few words about Marma Therapy. If you're not familiar with it, it comes from Ayurveda, which is traditional Indian medicine. It's more than 5,000 years old. I really appreciate Marma Therapy because it's a non-invasive therapy. It is an energy therapy, so all of Ayurveda is an energy therapy, and other paradigms of medicine such as homeopathy are energy therapies, and acupressure, acupuncture, that sort of thing from traditional Chinese medicine. There are 117 Marma points on the body. And as an energy therapy, you kind of have to shift your mindset a bit and start thinking about people, diseases, states of health as energies or waves, rather than a biomechanical or a biochemical process. Although they're not mutually exclusive, you can use conventional therapies along with Marma Therapy, but Marma Therapy, the paradigm from which it comes, it's really an energy modality. So the touch here is used to allow these energies to rebalance themselves, and you don't have to push hard or long. Sometimes people have that kind of mindset, especially if there's a lot of pain. You don't want to induce more pain. You want to be very gentle. If you're interested in more history on Marma Therapy, I would check out my very first Marma Therapy video, Marma Points on the Hand, because there's more there. If you'd like your own experience, if you'd like some example of how to work with these points, I also created a video, Marma Points on the Hand follow-along video. It's a separate video. So I talk about the points first in the hand video, and then I work with them in the follow-along hand video. So you might check those out. Other Marma videos related to this, so other parts of the leg, like the thigh and the knee, I've done videos on those as well. And actually even the mind. A lot of these points on the feet are related to the mind and also the sexual organs. So you can check out the various videos really on the whole head, and then also the pelvis that you might check out if you're interested in more of those sorts of therapies. If you're generally interested in this sort of content, I would check out my Marma Therapy, Ayurveda, and Body Care playlists. I always organize my videos into playlists so that they're easy to find. So there you go. So let's go through it. We've got 6 points today. The first 2 have the same name, Gulfa, which means ankle in Sanskrit. There are 2 on each leg, so 4 total on the body. There's a medial Gulfa and there's a lateral Gulfa. So the medial Gulfa point, the way that you find it, you go to the inside or medial side of the ankle. And then there's the malleolus there, that sort of big bump. So all you do is go 1 finger below the bump and 1 finger back. So 1 finger angula inferior and 1 finger posterior to that malleolus, that big bony structure there. That's how you find the medial point. The lateral point is the depression below the lateral malleolus. So this you just drop down off the bony point and into the soft tissue, and that's your lateral point. Okay, so medial and lateral points here. The energies balanced by these points are the pranavayu, the vyanavayu, the upanavayu, and the shleshika kapha. If you, this is more meaningful to deeper students of Ayurveda. If you're not, that's okay. You can still get a lot of benefit from these points. Just as one example, though, I'm not going to go through all these energies. I'm planning on making other videos about the different sort of subdoshas, the different wind and fire and earth energies, because that's what these are. Just as one example, shleshika kapha is the earth energy involved in creating the lubrication for joints, that kind of watery gel substance. So that's shleshika kapha. So by working with these 2 points, you're actually helping to balance and improve the distribution of shleshika kapha. But again, you've got to take this in context. So if you're not hydrated enough or you're not getting good oils, it's going to be hard to produce any lubrication in your body. You're not going to magically create shleshika kapha just by rolling your ankles. Yeah, so you got to... And I have videos on pitta, vata, kapha nutrition. So if you're interested in nutrition, Ayurvedic nutrition, I have videos on all 3 of the doshas there. Okay, and also before we get into the indications, these 2 points are contraindicated in pregnancy. So pregnant ladies, it may sound like a good idea, but don't do it. All right, so as I've mentioned before, all Marma points have local functions. So we're looking at, with these 2 points, things related to the ankles like pain, sprains, swelling, arthritis, also circulation of the feet when that's poor, and there's like coldness of the feet. These can help. These 2 points also help with kidney and bladder, so general kidney function, water filtration, renal colic, that sort of thing, bladder incontinence, retention of urine, and difficulty with urination. These 2 points also pacify kapha dosha, which is an earth energy, and that specifically is very important for psychologically for things such as like depression, also materialism if it's out of balance, greediness, that sort of thing. I do have a video on Ayurvedic psychology. If you're interested in that video is available to you. So any sort of emotional disturbance related to kapha can be helped with these points. And the lateral point here, the lateral Gulfa point, is helpful with sexual organs, ovaries in women and testes, prostate in men. Also, these can be helpful. You have to kind of distinguish, like if there's swelling around the ankle, that can be for a couple of reasons, 2 main reasons. If you find puffiness around the ankle and the lower eyelid, especially if it's worse in the morning, that's generally a sign that there's some stress with the kidneys. So it's basically renal edema. If, however, the swelling increases around the ankles as you move through the day, that's usually a sign of cardiac edema or poor venous return. So a little bit of diagnostics in terms of, what's causing the swelling. You always have to get to the root cause. Like no matter what therapy you're using, get to the root cause, and you'll save yourself a lot of time and trouble. But there can be different reasons why the ankles are swelling, so keep that in mind. If you're going to work more on the kidneys or the heart. So the third point here is padacharana, which translates to foot movement. There's 1 on each foot, so 2 total. And this point is located on the front of the ankle joint. It's a depression between the tendons of the hallucis longus, which is the tendon that runs straight up. It's the kind of string. It's almost like a string that runs from the big toe up to the ankle, and the hallucis longus, which is the tendon over, which actually moves the other toes and stuff. So that's the hallucis, the extensor digitorum longus. So the other tendon that extends or straightens the toes. So right in between those two, you'll kind of feel there's a natural little divot there. That's where you want to be. The energies balanced by this point are the pranavayu, the vyanavayu, the apanavayu, the alochika pitta, and shleshika kapha. So more lubrication for the joints. That's nice because the feet are used too much probably for most people. Indications for this point: local, again, ankle pain, swelling, edema, circulation of feet, coldness, that sort of thing. Bladder, so things like cystitis and pain. This point can also work on the colon, so dysfunction generally, constipation, flatulence. There's also some relationship with the eyes because of the alochika pitta, but I did a whole video on eye. There are so many eye marma around the eyes. I probably would go there first if there's an eye problem, but you might get some added benefit from working on this point. The other thing is that the point on the right leg is related to the ascending colon, and the point on the left leg is related to the descending colon. All right, so that's your third point, Padacharana. The fourth point, Padakshipra, so foot immediate. So this is actually what they would consider a first aid point in Marma Therapy. So there's one on each foot, 2 total. This is the midpoint of the base of the nail of the big toe. Okay, the energy is balanced here: pranavayu, udanavayu, vyanavayu, apanavayu, almost all the vayus, tarpika kapha, and shleshika kapha. So tarpika kapha is interesting because tarpika, not to get into all these energies, but tarpika kapha is related to memory. Like long-term memory, short-term, but also long-term memory. Indications, again, local things like pain and swelling. But this is interesting, again, so, tarpika kapha, I mentioned, like there's mind stuff here. So this point can actually help with headaches, migraines, insomnia, pituitary imbalances, that sort of thing. It activates prana, which is the life force. So if there's some sort of almost collapse or almost, that sort of thing, this point, along with points on the hand, like the point on the thumb and the little finger, those are also considered first aid points in Marma. So because it activates prana, life force, it can actually help with heart and lung function, like shortness of breath. So if somebody's in distress, this might be a good point to look at or consider. This point is also helpful with sexual organs, so again, ovaries, testes. It also regulates kundalini energy. So kundalini energy is energy they kind of talk about it like this energy that's sort of coiled up like a snake at the base of the spine, or, near the first chakra, Muladhara chakra. And if this energy starts to activate and move through the body, if you can get it to ascend up the spine into the mind, that will help with spiritual development, enlightenment even. It can, though, move downwards or outwards, in which case somebody might become really over-sexualized or very attached to the material world, greediness, that sort of thing. So if you're attempting to regulate kundalini, so maybe what you're attempting to do is maybe if your kundalini is descending and you're thinking about increasing, improving your spiritual practice, but you get distracted by the material world and relationships and that sort of thing, you can work with this point to help diminish libido. But again, diminish it meaning that energy, that kundalini energy, is being directed upwards towards the mind and the crown chakra. So it's not that you're drying out your sexual organs or something like that. It's just you're redirecting energy that can be used in either way. So doing something like sitting in half lotus pose, for example, will stimulate this point. That's a lot of why lotus pose and half lotus pose and things like that, or poses like that, actually just sitting poses, are considered so important. And in different yoga texts and stuff like that, actually they always say that the most important yoga poses are the sitting ones and the meditation ones. So all the other poses are kind of will work up to that, because what you're trying to do is transcend the body as you move your body and you're feeling better and your knee pain is going away, if you're doing yoga properly and not excessively. Then you start to transcend the body, because the body doesn't need attention, like medical attention, for example, and then you can focus on the mind. So all the moving poses and then the sitting poses are for, meditation, so that you can also transcend your mind. So once you transcend your body and you transcend your mind, you're right there with your spirit very clearly. So yeah, that's really what yoga is about. But let's see what else do I have here. Okay, so the point on the right foot stimulates pitta, if you need to balance pitta. The point on the left foot stimulates kapha. If you do them both together, that will stimulate vata. So it's another way of balancing the doshas. And then there's also here's some information about another way to work with the kundalini energy is like if you suck in your anus, that's called Ashvini mudra. And that's one way to direct the energy kundalini upwards, up the spine towards the mind for spiritual awakening. And again, if the energy goes downwards, there's more of a materialistic association, potentially. Sometimes it's suggested for some people, if they put a copper ring on the left toe, that's one way to direct the energy up to the right brain for enhanced intuition and creativity. So there you go. If toe rings are interesting or attractive to you, you might consider that. So the fifth point here is Parshni, which translates to heel. There's one on each foot, so 2 total. This is one angula or finger inferior to the calcaneal tubercle posterior aspect of the heel. So this is a little bit of a funny picture, because this is the bottom of the foot and the point is on the back of the heel. So right at the edge there. But I use this picture so that I didn't have so many pictures to use for the summary slide at the end. So that's why. But basically it's right at the tip of the heel there, actually more at the back rather than on the bottom, but that's where this point is. So the energy's balanced here, Vyana Vayu, Apana Vayu, Shleshika Kapha. So you can see, again, this point is also helpful for lubrication of the joints. Indications, local as always, feet, pain, circulation, edema, swelling, arthritis, tendonitis, plantar fasciitis, as you can imagine. This point, is unusual of the 6 feet points because it helps with the lower back. So things like lumbar radiculopathy, which basically is sciatica. There's a impingement of the sciatic nerve. Lumbosacral pain actually can be helped with this point. And again, sexual organs, so ovaries, testes, prostate, with Parshni here. And then the last point, Padamadhya, which translates to foot middle of the foot. There's one on each foot, so 2 total. This is on the sole of the foot, between the second and third metatarsals. So between the second and third toes, if you go to about 1/3 of the way down from the base of the toes, you can see the little diagram here on the picture of the foot. So it's in the middle, but it's like 1/3 down from where the toes are between the second and third toe. There you go. So the energy is balanced here. Pranavayu, Vyanavayu, Pachaka Pitta. Indications local again, feet, lower extremities pain, edema, swelling, coldness, neuropathy. This point is also good for balancing the mind. So things like headaches, migraines, general equilibrium, vertigo, lightheadedness, insomnia, stress, hyperactivity. And again, because of the Pachaka Pitta energy here in the list, that's related to actually digestive fire. So you can actually help to balance stomach and pancreas function with this point. So things like digestion, peptic ulcer, hyperglycemia can be helped here. And because of that fire nature, digestive, that relates to the solar plexus or 3rd chakra. So some interesting indications for some of these foot points here. So there you go, 6 points. Let's just go through, bring it all together, integrate the information here. So we got 6 points, 2 on inside, outside of the ankle, 2 on the top of the foot, and in my mind, 2 on the bottom of the foot. That helps me remember it, even if it's, you gotta adjust a little bit. So again, all Marma points have local effects. Points 1, 2, 4, and 6. So the Gulfa points, as well as Pada Kshipra on the top of the big toe, base of the big toe nail, and also Pada Madhya, the one in the middle of the foot. They actually are very helpful for balancing the mind, and especially because they specifically work on balancing kapha dosha. And kapha, it's kind of funny, I had a patient who came in recently, and I was thinking, maybe I should really, we've been doing some other things, but she's struggling a little bit because of some trauma in her past, and I was thinking, maybe we should talk about doing like a foot massage daily, because it would help with the mental aspects of what she's dealing with, I think, especially because they're tied so far into the past. Anyway, just a extra thought there. The third point, Padacharana, that can be helpful with the eyes, but again, if there's an eye situation, I would probably go to the eye points first. I have a whole video on that. Point number 4, top of the big toenail there, can help with heart and lungs, because again, that's the first aid point. Stomach and pancreas, Pada Madhya, 6th point. Kidneys, the Gulfa points, bladder, the Gulfa, so all the ankle points 1, 2, and 3. Padacharana, front of the ankle, is the colon, can be helped. Parshni, the back of the heel, that can help the lower back. 2, 4, and 5, so the lateral Gulfa point, as well as the Padakshipra, big toenail point, and the Parshni point, the back of the heel. Those can actually help with regulating sexual organ function. Kapha dosha, the Gulfa points, stimulating prana generally, the Kshipra point on the big toenail, because again, that's just general vital force, vital energy. That one's also important for working with the kundalini energy, if that's what you'd like to do. And then the Pada Madhya point in the center of the sole of the foot is helpful with balancing the solar plexus or third chakra. Yeah, so a lot of interesting indications here with the foot points, and very much so like with the hand points. I mean, you can actually help a lot of things if you just know the feet and the hands. If you know them like inside and out, you can help a lot of things in the body, so, and the mind, so, and the energy and the sexuality and spiritual enlightenment. Like, it's amazing how much is there. So ways to work with these points. Again, you can gently press them. If you're interested in, again, an experience of that, I have the Marma Hands Follow Along video. You can check out and follow along. Give yourself a Marma treatment. You can use warm and cool packs, but if you do that, you need to know more Ayurveda, really understand some of these Prakruti, and Vakruti, to understand what's causing the issue. So if it is a vata or kapha issue, you can use warm to balance them, because vata and kapha, wind and earth, are cool energies. And if it's a pitta inflammation issue, pitta fire inflammation issue, you can use cool. But again, you'd have to know more Ayurveda than what I'm presenting here. You can also do Abhyanga, warm oil massage. If you do, you could do like a warm oil massage on your feet daily to help with these things, help balance these energies. You can also, just by meditating and breathing, sending your breath energy, prana energy to these points will help to stimulate them, because this is all energy work. Walking, probably gentle walking, usually helpful, because again, by walking, you're stimulating all these points. Biking also, by like rolling your foot over the pedals, you're stimulating pretty much all these points. Just simply doing ankle rolls inside and out will get at least 3 of these points. There's also what you can do is you can like write the alphabet, so A, B, C, D, with your toes and your feet. So that's going to get you moving your feet and your toes, and in all directions. So you can write the alphabet with your feet. That's another way you could stimulate these points if you want. It's kind of fun. And you can do it with kids. So there you go. Teach them the alphabet and teach them Marma at the same time. Yoga. So basically moving through your practice, moving from pose to pose, being up on your toes, walking back, all that. Anytime you're using your feet, you're stimulating these points. And as we mentioned, lotus, half lotus pose, Padmasana, where having your ankles tucked under you, your feet tucked under you or next to you, stimulating these points can do the trick as well. So there you go, points on the feet, and there you go, a whole course. Again, I never really, when I started, I never really had the intention of doing a whole course, but it looked like people were interested in learning. So there you go, a whole course on all the points. Even though this is the last video on the points, I'm planning on doing more videos on how to work with the points, because this is kind of just the foundation. And then, since it's energy medicine, the way you work with the points can really make a difference with how effective the therapies are. But at least you have the foundation, at least you have the points, at least you know where the points are, hopefully at this point, and keep working with them. And then the future videos that I'm going to roll out are going to help refine and modify and up-level knowledge and information about how to work with these points more effectively. All right, so wow, I feel like, I don't know, like really excited. Like, I can't believe I did the whole thing. But great. Yeah, so maybe time to put on some dancing shoes and party a little bit. But otherwise, as always, I hope you found this interesting and helpful. And until the next video, take care. Namaste.